Hello and welcome to Rajya Sabha TV watching Question Hour, a unique show where we get you latest from the Parliament House and the questions asked by the members in the 251st session of Rajya Sabha. I'm your host Rajat Kain. I'm joined with my colleague Kriti Mishra.
Thank you so much, Rajat. So let's take our viewers to important questions and answers that we've picked for them in this edition of Question Hour.
Well, the first question of the show was asked by member Vandana Chavan from Ministry of Health and Family Welfare, and she asked about the number of registered assisted reproductive technology clinics in country and the total number of IVF recipients in ART clinics during the last 3 years and current year. She has asked for the figures year-wise.
In the response, the government says that as per the National Registry of Assisted Reproductive Technology Clinics and Banks in India being maintained by the Indian Council of Medical Research, 512 ART clinics are enrolled with the registry. However, no information on number of IVF recipients in ART clinics is available. The proposed upper age limit for reception of embryo donations for women is 50 years. The donor shall be a married woman having at least one child of her own, not below the age of 3 years, and may donate only once in her life. And the government further says that the proposed Assisted Reproductive Technology Bill 2019 is being placed before the Cabinet for approval and subsequently for its introduction in Parliament. In fact, member Vandana Chavan joined us on the Question Hour show, and this is what she had to say on government's response to her query. Listen in. And joining us on the Question Hour show is questioner Madam Vandana Chavan. Ma'am, welcome to Rajya Sabha Television. You asked a very interesting question about assisted reproductive technology. How important is the issue?
It's an extremely important issue because we see that there are a lot of couples nowadays who go for IVF to the clinics and want to get treated. If you see some of the statistics, I found that almost 25 million couples are suffering from infertility. And surprisingly, this infertility is not always genetic. It is triggered because of stress. It is triggered because of the pollution, and these are matters which, the government or all of us are responsible for. So if there are infertile couples, they have to be helped, and then this help has to come from the government through legislation. And therefore, ART, as you know, there is no law at the moment. It has been pending for a long time, since 2010. For the first time, the bill was drafted, put into public domain. Then again in 2014, unfortunately, it has not yet been passed. In the meanwhile, the surrogacy bill came up. It was passed by the Lok Sabha, then was tabled in the Rajya Sabha for being passed. But good sense prevailed. Fortunately, the government also gave in when there was a demand that this bill needs to be sent back to a select committee, should be properly deliberated, actual provisions need to be studied upon, and then should be tabled again. We have done an extensive tour to meet people, meet surrogate mothers who have gone through this process, because we always thought they have been exploited. So we really wanted to get a first-hand information. We went and met intending couples who want to go into this. So basically, and also went to a lot of clinics where surrogacy takes place. And all of them, in fact, wanted a regulation to come in. And I'm glad that the committee has tabled a report only today, and we have said that even before the surrogacy bill comes in, the ART bill needs to come in. And that probably will hopefully happen soon.
Ma'am, the ART bill, how will it regulate the hospitals or the clinics providing these services?
Fortunately, at least there is a national registry for the assisted reproductive technologies. However, if we see the statistics of the IVFs and things has not been kept. We have been able to do it for the sex determination under the PCP&DT Act. So I think this is absolutely possible. And while doing this, we need to keep a national registry, not only for the alternative reproductive technologies wherever they are used, but also for surrogacy, the surrogate mothers, the intending couples, so that the process is entirely transparent. As far as the ART is concerned, the registry at the moment does give the number, says that the number of clinics need to be registered. There are some 512 clinics. I had asked a question, and in response the government has said there are some 512 clinics which have been registered. There are a lot of other clinics which are existing but not registered. So all this now would come under a domain where if a clinic is not registered, will be legally held liable. Secondly, there is a lot happening on the donation of eggs and donation of sperms. We have had a lot of cases. There was a case in Mumbai, in my own state of Maharashtra, where the High Court intervened, and High Court said that the girl is being exploited. She was a 17-year-old girl. The girl doesn't know what's happening. She's taken to a clinic. She's told कि 5 minute का काम है, and they are taken to clinics by social workers. Probably the birth certificate also was there, was not there. I'm not very sure. They are shown an Amish ki 15,000 रुपए आपको मिल जाएंगे, and the poor women, the poor girls are lured by that. So basically this will not be done in future. The oocytes or the sperms which are taken from the donors would be kept in banks, but later will have to be disposed of. They also should not be illegally, sold to people, and money should be made for such kind of illegal means. So everything should be a transparent process, and this is what we are looking out for. In fact, I also, when we went to some of the clinics, I also went through some of the registered that are maintained by some of the clinics as to the ladies who have donated their eggs. And it was interesting to see that the clinics also try to match the look of the lady with the look of the mother, but it is not regularized, unfortunately. What if somebody wants a fair child and a blue-eyed boy, as one of our colleague kept asking? Of course, we don't have blue-eyed children in our country, but I mean that's a way to show that you can choose your child. So that cannot be done. That should not be done. And therefore, this entire act has to be regulated.
Absolutely.
And that is what we are looking for.
Absolutely, ma'am. Those are very important points that you're making. Thank you so much for joining us on the Question Hour show.
Thank you, Kriti. Thank you.
Now let's move on to the next question that has been asked by member Vijla Satyanath, and this one is to the Ministry of Finance. And the member has asked the government whether it is considering additional capital infusion of 30,000 crore rupees in public sector banks.
Well, replying, the government said it has considered the requirement of additional capital infusion in banks and has made budget provision of 70,000 crore for this purpose in the current financial year. Government has infused rupees 64,612 crore in PSBs and 4,557 in IDBI Bank Limited. In October 2017, the government had announced recapitalization of banks to the extent of rupees 2,11,000 crore over next 2 years, including raising about 58,000 crore by banks from the market. Now, against the envisaged raising of about 58,000 crore, banks have so far mobilized 57,512 crore from sources other than Government of India, including market raising since announcement in October 2017. Moving on, the next question was asked by member Shanta Chetri from Ministry of Tourism. And she sought whether Ministry has opened 120 mountain peaks of mountaineering and trekking to boost tourism in India.
In the response, the government says that Ministry of Home Affairs Foreigners Division on 13th of August 2019 opened 137 peaks located in 4 states. These states are Uttarakhand 51 peaks, Sikkim 10 peaks, Jammu and Kashmir 15 peaks, Himachal Pradesh 47 peaks to foreigners desirous of obtaining mountaineering visa, climbing or trekking subject to necessary clearances by appropriate authorities for issue of inner line permits, PAP or AP, as the case may be, and clearances by security agencies. Thereafter, on 4th of September 2019, the Ministry of Home Affairs deleted 14 peaks located in the state of Sikkim from the above list of total 137 peaks. Let's move on to the next question that has been asked by member Sushil Kumar Gupta, and this question is to the Ministry of Health and Family Welfare. And Mr. Gupta has asked the government whether it is a fact that a high-level team comprising of experts from AIIMS and Jodhpur and other experts was sent to government hospital in Kota, Rajasthan, where more than 100 infants died in December 2019.
But giving a detailed reply, the ministry said yes, a central team comprising experts from AIIMS, Jodhpur and Ministry of Health and Family Welfare was deputed to visit JK Lone Hospital and Medical College in Kota district of Rajasthan following the reports of death of children in month of December 2019. Now, as per the report submitted by the central team, out of 100 deaths reported in JK Lone Hospital, 70 were in neonatal intensive care unit and 30 deaths in pediatric intensive care unit, a pediatric ward. Majority of neonates who died were low birth weight and 63% died in less than 24 hours of admission. Majority of death cases were referred cases from district hospital in Bundi and district hospital in Baran. The bed occupancy rate of NICU, that is neonatal intensive care unit, was 125% and pediatric intensive care unit is 186%, resulting in sharing of beds. Bed nurses ratio for NICU and PICU is 10:1 and 6:1. That means and 1 nurse per 6 beds in PICU against a norm of 2:1. Many of the equipments in the hospital were non-functional and there was no equipment maintenance policy. The team recommended strengthening of infrastructure, adequate manpower and use of standard clinical protocol besides strengthening primary and secondary healthcare services at sub-district level. Moving on to last question of the show, that was asked by member Kirodilal Meena from the Ministry of Culture, and he sought whether a national mission of monuments and antiquities has been launched by government with the objective of promoting cultural awareness among people through conservation of heritage places, and training is provided in non-government organizations and universities under this mission.
The answer given by the government is in affirmative, and it has launched a national mission on monuments and antiquities with the objective of promoting cultural awareness among people through conservation of heritage places, and was initially approved for a period of 5 years, that is from 2007 to 2012, in the 11th 5-year plan, with the objective to prepare a national database on built heritage and sites and also antiquities. Later, it was extended up to 2017, and now it is running as a section of Archaeological Survey of India. National Mission on Monuments and Antiquities was launched with a mandate to promote awareness and sensitize people concerning the benefits of preserving the historical and cultural aspects of built heritage, sites and antiquities, and to extend training facilities to the concerned state departments, NGOs, universities as well as the museums. The National Mission on Monuments and Antiquities is not promoting cultural awareness among the people for conservation of heritage places, particularly in Mithila region of Bihar. So Rajat, that's all we could pack for our viewers in this edition of Question Hour. But on the other side, we'll have Prashnikal in Hindi with our colleagues Arvind Singh and Kriti Singh. Please stay tuned to Rajya Sabha Television.